So, good morning, and today we are going to hear from Dr. Laura Flexer and Dr. Kuki Avery. Both are GPs and are menopause specialists. Following the doctors, we will hear from Catherine Hare. Catherine is a professional support lawyer with Citation, and we'll be talking about managing long-term illness. And last but not least is our very own Alethea Mixon, who from Care and Support West. Alethea is going to take you through a very useful session entitled Looking After Yourself and Your Colleagues. So without further ado, I'm going to stop talking and hand you straight over to our first speakers, doctors. The virtual floor is yours. Thank you.
Thanks, Karen, so much. Laura, are you happy to share your screen?
Yeah.
So hi, everyone. Thank you so much for coming along today, and thank you for the invitation for us to speak, Karen. So just to start by introducing ourselves. So I'm Kuki Avery, and Laura Flexer, my lovely colleague, is also going to be doing this presentation with me. So as Karen said, we are both NHS GPs, but we are also British Menopause Society menopause specialists. And
recording in progress.
Sorry, can you hear me? So together we have set up Wellbeing Menopause, and Wellbeing Menopause is a private doctor-led menopause clinic, and we currently see patients all over the country through video consultations, and we are due to open a face-to-face clinic in Litfield House in Clifton in Bristol shortly, which is really exciting. And then alongside Wellbeing Menopause, we've also set up Menopause Aware. And through Menopause Aware, we go into businesses and we educate businesses about menopause in the workplace. Now, we know that all of you have lots of very highly valued female team members who've been in their role for years, know their jobs inside out. And when these women hit menopause, it can be really challenging and tricky. And our role in this business is to help support you to support these women so that they can thrive and go on to reach their full potential. So what we're going to do today is just a short presentation. I'm going to start by talking about what menopause is, what symptoms women experience, why they experience these symptoms, and then Laura's going to come on to talk specifically about menopause in the workplace, and then talk about Menopause Aware and how we can support you to support your women. So what is the menopause? So the name itself describes it. So meno meaning mens is periods, and pausa meaning stop. So it's a diagnosis that is made retrospectively. So we diagnose the menopause 1 year after a woman's last period. Now, the perimenopause is actually when symptoms start, and this can be many years before the menopause itself. And what exactly happens around this time is hormone levels drop off. So the ovaries stop working and estrogen and progesterone levels really fall. So the average age of onset in the UK is actually 51 years of age. But what this graph shows is that there is a real spread of ages. And women who go through menopause between the ages of 40 and 45 are deemed to have had an early menopause. And women who, so as you can see, there's a proportion of women who actually go through menopause earlier than 40, and these women have a condition called premature ovarian insufficiency. But the key message to take away from this slide is that menopause can happen at many different ages, and it's not just when you hit 50 that we need to be thinking about it. So the perimenopause, this brings me on to the perimenopause, which is the transition phase before menopause. And this can actually last 10 years. And so what happens during this time? Often that women notice a change in their periods. They can become less frequent, more frequent, heavier, lighter. And this is due to changes in the ovary. So the ovaries start to malfunction and they start to produce fluctuating levels of hormones. And these fluctuating hormones are what cause the symptoms in women. And women often feel really, really awful during this stage. You know, their hormones all over the place. They do not feel themselves. And we need to remember that that has an impact on the men folk in our lives. And that's not only our partners and our sons, but it's also our colleagues. And what we want to do is explain why it is that women don't feel themselves. So this is a lovely graph that talks us through the hormone changes throughout our lives. And as you can see at the beginning, in our reproductive years, we have a lovely fluctuating cycle, which is in sync with estrogen and progesterone going up and down in time, and then a regular period. Then we come to the perimenopause, which is this menopause transition, which I've alluded to can last up to 10 years. And this is when the ovaries start to malfunction. And as you can see, the hormone levels become very fluctuant, very variable, very erratic. And this is when women start to experience all sorts of troublesome symptoms. And then in the postmenopausal period, these hormone levels drop right off. So this is a really handy slide to just show how important estrogen is on the woman's body. And in fact, we have estrogen receptors almost all over our body. And just to pick out a few of these, and the reason why I'm showing you this slide is because, as you can imagine, when estrogen levels drop right off, all of these bodily functions start to get become impacted on. So estrogen is really important for protecting the heart. Again, we know that estrogen is really essential for bone strength and bone density. Thinking about the brain, without estrogen, women struggle with memory function and can struggle with what we call brain fog. And then obviously it's important for reproductive function as well. So symptom-wise, I think a lot of us know about the classical hot flushes, night sweats, but what I want to get across today is women experience a whole array of different symptoms. So it's not just the physical symptoms. Women often experience awful joint pains, extreme fatigue, but also women can experience quite severe psychological symptoms and sexual dysfunction as well. And I'm not expecting you to read this. This is just a really useful questionnaire that you can signpost women to. So if you were to put into the internet green climacteric scale or menopause symptom checker, this will come up. It's a really useful tool for women who are struggling with possibly perimenopausal symptoms to put their symptoms in. And we use it in our clinic to not only highlight what are the women's most concerning symptoms, but also to follow women up and make sure that things are getting better. So the psychological symptoms are some of the most common symptoms that we hear women talking about. And these here are just some of the few things that we hear women say every day. And this can have such a profound impact on women's life and lead to loss of confidence and a loss of self-esteem. And it's not only these, but menopause often comes at a really challenging time of a woman's life. Often women are reaching the peak in their career, but also they're often possibly taking on caring roles of elderly parents, or children are leaving off for university. It's empty nest syndrome. So it can be a really stressful time in life. And what I want to say here is that these psychological symptoms, the women that we see every day in our clinic, the women really stress that they are having a huge impact on their ability to work day to day, and particularly on their jobs.
So I'm going to talk a little bit now about menopause in the workplace specifically, just leading on from what Cookie said. So menopause occurs on average, as Cookie said, at about 50. And actually, this has been fairly constant for centuries, we think, and is not affected much by race, age of onset of periods, social and economic factors, body weight. But with increasing life expectancy through the 1900s, menopause and its problems has come to occupy an increasingly prominent place in our society. This is just a graphic representation of the increase in the number of women in the 45 to 59 age bracket, a number that stood at 657 million in 2020, so probably a bit more now. And of that 657 million, 47% of those are in employment. And actually in the UK, women aged 50 to 64 are the fastest growing economically active group. Of the 70% of women in the UK who are employed, there's almost 4.5 million women in that age bracket. And what does this mean? Well, it means that many women are working as they enter the menopause transition, which, as Cookie said, can last 7 to 10 years, where women may be experiencing really challenging symptoms that can impact them at work. And so menopause in the workplace really is a topic worth talking about, and menopause is everyone's business. So menopause affects all women. It is a truth as universal as death or taxes, that if you are a woman and you live long enough, you will go through the menopause. And actually, the majority of women do experience symptoms, and about a quarter of women will have very severe symptoms that can have a really profoundly negative impact on them. And, you know, we know that not enough women seek help. We've said that women over 50 are the fastest growing group in the workplace, and with the rising state pension age, this is only going to increase. So we've talked a little bit about symptoms, and the symptoms are far-reaching beyond the sort of physical hot flushes and night sweats. And actually, as Vicky said, the psychological symptoms are the ones that can have a really profound impact on a woman's life, particularly at work, leading to lack of self-esteem, lack of confidence, the anxiety, the brain fog, fatigue, poor sleep. Sleep issues are very common and can really impact on performance. And let's not forget those physical symptoms of hot flushes, heavy periods, needing to go to the bathroom more frequently than usual. It can be very inconvenient and embarrassing for women at work and make the workplace a difficult place to be. This was a survey that was done last year on nearly 4,000 women. And the results of this survey are really shocking. So 99% of women said that their menopausal symptoms negatively impacted them at work. And this is what we find in our clinic, you know, that you know, more often than not, women who are in employment will have mentioned the impact on their symptoms at work really early on in the consultation before being prompted. And it's often the thing that's tipped them over the edge into wanting to go and seek help. So nearly 60% took time off due to their symptoms, nearly 20% reduced their hours, and really worryingly, more than 10% actually resigned from their role. You know, so you can see that it's not just menopause and the symptoms, but it's actually the fact that women are not seeking help. And so why are women not seeking help? Well, women are often not aware that their symptoms are due to the menopause, and sadly, aging is still synonymous with declining capabilities. Stereotypes do still hold strong. There's workplace bias, gendered ageism is still very prominent, and women worry that they will become hyper-visible by bringing menopause to the attention of others. And women worry that their workplace won't respond positively and provide a psychologically safe space for them to discuss their symptoms without judgment. And you know, we really feel that with education, women and their employers will be able to recognise the signs and symptoms of the menopause and seek appropriate help so that women can stay in work and feel valued in the workplace. And we really believe that with the right treatment, women should be able to go on and enjoy their careers at this stage in their lives. So why is it important to retain women at work? Well, women at work makes for a positive, diverse workforce that is reflective of the population. And of course, you know, employment has a variety of positive social and psychological outcomes for women. We know that the older a woman is when she leaves work, the less likely she is to return. And as you said, women over 45 make a significant contribution to the economy. And these are often really highly valued, respected employees with many, many years of experience. We know that women are more likely to incur financial hardship later in life than men, and so clearly employment is going to benefit them in this way. Actually, work is one of the few places where intergenerational relationships still exist outside of the home, and colleagues can be a great source of support. And actually, the majority of women actually want to work through their menopause. So if we start thinking about the relationship between the workplace and menopause and think about how we can support women through this transition, we will be able to retain more women at work through this phase in their lives, which is really crucial. So in 2016, the European Menopause and Andropause Society made workplace recommendations for women going through the menopause, and this was updated in 2021. And this is for businesses and organisations as well as for individual managers and supervisors. It's obviously a very long document, so this is just the highlights, if you like. So they recommended a clear menopause workplace policy and highlighted the importance of a positive approach so that outdated perceptions and negative attitudes towards menopausal women are not reinforced. You know, the misconception that all women of this age have impaired performance at work can actually negatively enhance attitudes towards older women in the workplace. They recommended to include menopause in more general health and well-being policies, again, to avoid stigmatization of women experiencing menopausal symptoms at work. They highlighted the importance of educating managers and supervisors about menopause and the problems it can cause, and that part of this training should be around being able to have those sensitive conversations around this topic at work. Women find it difficult to talk about their symptoms, and so looking at barriers that might actually inadvertently be in place, like having a young male line manager who's the first port of call to discuss, their symptoms, is clearly not going to be overly helpful. Training of existing and new staff is essential to create an open, inclusive and supportive culture at work around this topic. And they recommended the development of an employment framework that recognises the potential impact of menopause and provides confidential sources of advice and guidance for women via specialist advice at a menopause clinic, occupational health physicians and human resources. So where do we come in? What do we do? And you'll recognise some of this from the EMAS slide, but actually, that's the point. EMAS have made the recommendations, and we want to make this as easy and as accessible as possible for you, so that you can be a menopause-aware employer, support and retain your female staff, but actually be able to go on and carry on running a business. So improving understanding of the menopause. So starts with education, and this is not just for women going through menopause in the workplace, or not even just for women, it's for men too, it's for all staff, so that we can engender understanding and empathy about menopause in the workplace and what that might mean for your friend, your colleague, your employee. And we need to make these conversations productive to avoid creating a hostile environment. We want these conversations to be visible, positive and inclusive. So supporting you to support your employees, so training for staff to become menopause aware. We know that supervisor support is independently associated with lower menopausal symptom reporting at work. And we want line managers who can listen and respond sensitively to a colleague who's having issues around the menopause at work. Managers who are equipped with knowledge to be able to deal with the questions and thereby provide psychological safety for these women at work. Often being given a sick note and told to take time off is actually not the most helpful outcome. So help to implement changes to help staff, and these don't need to be things that fundamentally change your organisation. We work with what's there already, and small changes make a really big difference and can go a long way towards helping your female workforce to feel valued at work. Access to good quality evidence-based menopause care via our doctor-led specialist menopause clinic. We talked about the importance of training for line managers, but actually having the infrastructure in place to then signpost women to where they can actually get clinical advice is the next step. And it's often the step that's missing. And access to the latest evidence and helping to keep you up to date with your menopause policy. Your policies are meant to be useful. We want a menopause policy that doesn't sit in the cupboard and gain dust, but one that is useful. And this is about taking the latest evidence, distilling it down and making it relevant for you. And via these methods, we can improve productivity, reduce menopause-related leave, and improve the retention of these highly valued and respected employees with years of experience. So what's an example package? Well, we're really aware that businesses are not a one-size-fits-all. So actually, we try not to offer a one-size-fits-all approach. Clearly, a really big organisation is going to need something slightly different than a really small business. And so we try and tailor what we offer to individual needs. But an example package would be 4 menopause seminars a year, one-to-one support for your menopause mentor. We've mentioned that it's recommended that businesses have a menopause mentor, and lots do now actually, which is fantastic. But what we often find is that menopause mentor doesn't have a lot of confidence in that role. So we can be a point of contact for that menopause mentor, help get them up to speed and keep them up to date in all things menopause. Access to the latest information via our Chelby Health Hub. An individualized menopause policy that's actually relevant to your business. Use of the Menopause Aware badge on your website so that current and future employees know that you're a menopause aware business, and a 15% discount on appointments at our specialist menopause clinic. We really feel that with the right support, all women should be able to go on and enjoy their careers at this phase of their life. Thank you.
Thank you. Wow, gosh. I'm sat here thinking, yep, I can resonate with all of that because I've been through the menopause. So, ladies, that was really useful. Really good sound information. Does anybody have any questions you'd like to ask either of the ladies? There's nothing in the chat. I've written down a couple of things. The green climatic scale, we can get that easily, can we? We can have a look at it and sort of do our own sort of tick list and sort of go through it ourselves. Is that what is available?
Absolutely. So that is, if you put the green climacteric scale into Google, it will come up as a PDF, and you can print it off. We use it in our clinic, and we use it with our NHS GP patients. It's such a helpful thing for women to do. So it's a great thing to do before going to a GP, to say, gosh, I've got all these symptoms, I think I'm perimenopausal. But as I said in the presentation, we use it as well to make sure that we're identifying the key things that are really troublesome for women, and to then follow them up and make sure that we're actually getting on top of the things that are bothering them. But yes, anyone can access that. It's a really helpful tool, and great to signpost and someone who works for you who's struggling to do it to perhaps highlight, oh, perhaps this could be the perimenopause.
Okay. Lindsay has asked, is it for just private clinics, or can you use it to be referred to the NHS?
Oh, so we use it. Laura and I practice obviously as NHS GPs and menopause specialists, and we use it across both NHS and private. Absolutely, it's available to anyone. As I said, you can pop it into Google and get it on Google.
That's perfect. One of the things I've written down, getting better. I noted you mentioned the word getting better, and it's something to sort of, you will get better from it. You do recover from it, but at the time it doesn't feel like that, does it? Menopause mentor, I think that's a brilliant one. I think that's absolutely fantastic. I mean, confidence of the person who's being chosen as the menopause mentor. I think that's a little bit sad, isn't it? If maybe it's empowerment, maybe it's sort of given that person the empowerment in the workplace to sort of speak out for that person, maybe, or I don't know. It's difficult, but I think. Sorry.
Sorry, I think the menopause mentor is about providing support and offering women a psychologically safe space where they can discuss their symptoms with someone at work who knows what they're talking about and can answer those questions. And I think, you know, what we've found through doing this for other businesses is that often that person isn't particularly confident in that role, and that's where we come in and can really help. And you know, what the other thing that's really important here is that we want those conversations in the workplace to be really open, inclusive and positive, to avoid this sort of stigmatization and negative culture around talking about menopause at work, which really does exist. I'm sure lots of you here will agree with that it is still a don't talk about your hot flushes sort of situation, which is awful, actually. You know, we've made real inroads into supporting women through pregnancy at work, and we should be doing the same thing for menopause, really. I noticed in the chat, so someone said, is it a private clinic? So our clinic is a private clinic via Menopause, where we offer a discount on our consultations, and we are hoping that at some point we will be able to provide consultations via health insurance, but we're in the process of setting that up at the moment. Of course, you can ask for menopause support via your GP. That's entirely appropriate. I think women find it quite variable, the sort of the support that they receive via their GP. If you find a GP that has lots of experience in menopause, you know, you might be lucky. I think the real limiting factor is time in general practice, and actually even Cookie and I find that as menopause specialists, we do a lot of menopause at work as GPs, but it's very difficult to do it really well in 9 minutes essentially. And I think what's really important with menopause care is that, number one, it's holistic. So there's so many factors to cover when we talk about the menopause. And number two, women actually want to feel listened to. You know, they want to have time to really talk about the symptoms and explore the way that they feel. And via a private clinic, that really is what you get. Holistic care, time with a specialist who knows what they're talking about.
Okay. So, audience, if you would like to have more contact with either Dr. Laura, Dr. Cookie, if you want to put your email address into the chat privately to me, I will forward, and then you can have that connection if you would like to do that. Okay, do it privately to me, so you're not telling everybody your email address, or put it to everybody. That's entirely your choice. Okay, so ladies,
can I just say one more thing, Karen? So
yeah.
the other thing is we obviously do this subscription service through Menopause Aware, which Laura mentioned, but we also do ad hoc educational sessions. So if anyone wanted us to just come in and do a virtual hour webinar for their team, just talking about, you know, menopause and how it impacts in the workplace, we're really happy to do that as well.
That sounds wonderful. I'm happy that more and more people are talking about the menopause, but I know from my own experience of managing staff, I know that it can be sort of like embarrassment. I don't want to talk about it. It's a bit like got my period, don't want to talk about it. But it's a fact of human nature thing, isn't it? I mean, it's something that happens, and as you quite rightly said in your presentation, it's a fact of life that probably 99% of women are going to go through the menopause. So, okay, so I've got some emails coming through, so I'll share those with you. So if nobody has any further questions or any questions that they'd like to ask, we will thank the doctors. And I think you're going to move off now, aren't you? You're not going to stay. I'll send you the emails that have been sent through to me. Okay.
Thank you, everyone.
Thank you very much. Thank you for having us. It's been lovely to come today.
No, thank you for your time. Much appreciated. Thank you. Bye-bye. Okay, so I now hand over to our next speaker. I believe Leon joined us a little bit. Are you there, Leon?
I'm right here.
You're right here. Okay. Well, first of all, I'm going to hand over to Leon, and I think he's going to introduce Catherine. So over to you, Leon.
Thank you, Karen. So good morning to everybody, and thank you for putting aside some time to listen to my colleague, Catherine. I'm one of the team leaders here at Citation, so I'm going to tell you a little bit about us, and then I'm going to hand over to the main attraction, shall we say. So we
do have slides. Karen, are you okay to share the slides if possible? Karen there? Hopefully.
She's on mute.
Yeah, it's all right. I'm sharing. It's okay.
Oh, thank you. Thanks.
There we go.
Thank you.
So that's us. That's not me. That's not Kat. This is Citation. So today we're going to talk about very interesting subject, long-term sickness absence and medical capability. Catherine will talk about herself, but as you can see here, she's one of our professional support solicitors, a very good one as well. So she's well worth listening to. If you could click the slide on for me, please. So Citation, who are Citation? Some of you may well know us, but for those of you who don't, Citation, we've been around for quite a long time now, since the 1990s, and we help businesses across a variety of sectors with what we call compliance. So whether that's employment law, whether that's health and safety, whether that's regulatory sectors such as CQC or Ofsted. We have a number of other facets to our business as well, including professional accreditation such as ISO, and we've been here for, as it says here, over 30 years. We're a green company on a mission to achieve net zero, and I'm not going to read through the entire slide here, but you can see some of the small stats at the bottom here which really testify to our capability. Additionally, we specialize within the care sector. If you could flick the slide on, please. So we work with all of these and many more, and of course, not least with Care and Support West, who've been a trusted partner of ours for quite some time. And we put these up here because, if I'm being honest, I'll tell you all day long how great Citation are, but when these organizations agree to work with us, I think their opinion carries a little bit more weight. If you could click us on, please. Thank you. So just a little overview of Citation. As you can see here, we've got many assets to the company, Citation proper. Plus what we like to do within Citation is we find that the specific needs of our clients will sometimes dictate services outside the standard HR and health and safety remit, and we feel most confident when we're in control of those. So we have been on a mission over recent years to acquire trusted companies who can become part of our brand family to be able to deliver those services, not least for, I'm sure, many people on this call around services such as CQC support and accreditation. And if you can move us on one final time, thank you. Here we go. So here's the agenda. So enough about us. I'm going to hand over to Kat, who's going to talk to you about this important topic. It is employment law. It is something I'm sure many of you will have questions on. So if you want to drop those into the chat at appropriate moments, I'll monitor the chat and I'll feed those back to Kat and ask those questions on your behalf. And then I'll wrap up at the end.
Brilliant.
There we go. Over to you, Kat.
Thank you. I'm moving on the slide, please, Karen. Thanks. Hi, everyone. So yeah, if you do have any questions, please do pop them in the chat. Leanne can keep an eye out for them. If not, please do contact Karen afterwards, and you can pass the questions on to us and I'll happily answer them. So you can see that managing sickness absence is a really big issue in the care sector. And since January 2023, we've delivered nearly 5,500 pieces of advice on managing sickness absence. So you can see it's absolutely massive. It's so time consuming for businesses. So hopefully I'm going to give you some tips on how to manage sickness absence, in particular long-term sickness absence, and common pitfalls to avoid. Next slide. So it is a really difficult situation, managing long-term sickness absence. If you don't mind clicking through, Karen, sorry, there's 4 clicks. So there's obviously a human element. So it's really tricky because you're dealing with someone who's poorly, who's going through a really tricky situation. So obviously you've got the human element, but you've also got your impact on your team. So, you know, you've got service users that need to be cared for. And, you know, if someone's not there to do it, then the rest of the team need to pick them up. Or another alternative is that you get agency staff in to cover that, which is costly for the business and has an impact on the business. And then, of course, you've got the risk of, are you dealing with it correctly? If not, and there's a potential disability there may be risks of disability discrimination, unfair dismissal, etc. So it's a really difficult situation to manage. Next slide, please. So we get many clients who speak to us and say, well, you know, the person's gone off on sickness absence. They've been off for, you know, 4 or 5 weeks. I really don't want to bother them. What I would say is it's really important that you do maintain contact with individuals who are off on sickness absence and have what's called welfare meetings with them. Because if you have that regular contact with them, you can understand, well, look, is there anything we can do to help you back into the workplace? So in a menopause context, you know, if an individual is really struggling with lack of sleep or hot flushes, etc., it may be something you can look at. You know, well, you know what, we'll put desk fans out for you. We can maybe look at changing uniforms. You could perhaps do cooler uniforms or less tight uniforms, maybe things like that. Maybe adjustments which are quite simple and not too costly, which can then bring the individual back into work. It's also really important that you ensure that fit notes are kept up to date. So an individual can, of course, self-certify for the first 7 days of sickness, but after that, an individual does need to provide their fit notes. And if you kind of let that slide, that's when we have what's called malingerers, who kind of disappear and then we don't kind of hear from them. And then it's really difficult to bring them back into the workplace, to bring back communication with them if we've kind of just let them be at home and not communicate with the company. So it's really important that you kind of make sure that the fit notes are kept up to date. And just on that fit note point, just thought it was worth mentioning that since July last year, whilst a GP can of course still provide a fit note, there are other people who can now provide them. So registered nurses, occupational therapists, physiotherapists, and pharmacists can now provide fit notes, and they don't have to be signed. They can now be in digital form. So just something to be aware of, that if you get a fit note from a pharmacist, that is okay. So just to be aware of that, because things obviously do keep changing all the time. So yes, I think it's really important that you do have these welfare meetings and you come at it from a supportive point of view. You certainly would never be criticised by an employment tribunal for you saying, well, look, I really wanted to keep in contact with the individual. I wanted to see what adjustments I could make. And I wanted to let them know about what was happening in the workplace. You know, we're not replacing you. We've just simply got agency covers in place until you're off. So the individual feels like they're not being left out of communication piece. Okay, please. So when you think about sickness absence, it's really important, like I said, that you manage it and keep on top of it. So it's important you think about what's in your company handbook. Citation, the handbook that Citation produces, it's high level with regard to dealing with sickness absence, and that's deliberate, because if you sometimes have a procedure that's very bespoke and stringent, and for example, you know, after week 1 we do this, week 2 we do this, week 3 we do this, it's really tricky when you're running a business to make sure you keep on top of that as well. So the Citation handbook, it takes what the the procedure is with regards to reporting sickness absence, how it will be managed, but it certainly gives that fluidity in dealing with different situations. But it's really important you think about what's in our handbook, what do we commit to do when we're dealing with sickness absence, and make sure you follow that through, because if it did ever go to tribunal, an employer would look at the handbook and say, well, did you do what you were supposed to do when you were managing that sickness absence? It's important as well to think, oh, sorry. So it's important to think about as well about the sick pay. You know, do you have a contractual sick pay provision in your handbook? Because if that's the case, then you need to make sure you pay that, because that can have real implications from an employment engagement point of view if they're not paid correctly when they're off on sickness absence. Obviously think about statutory sick pay. So there are certain requirements that an individual must meet to be entitled to SSP. So in the 8 weeks before they go off on sickness absence, they must have earned at least the lower earnings limit of £123 a week. So just be aware of that. And of course, if an individual isn't entitled to SSP, you need to make sure you fill in that SSP1 form so you can identify why you're not paying them SSP, because if there was any kind of, if anyone looked into that, they would need to see the SSP1 form there. And just think as well about any underlying health issues. Now, if an individual does have just these persistent short-term sickness absence, then it is a case of that you may be able to just take disciplinary action for that under the capability procedure, because as a business, it's really difficult to work with a situation where you don't know if an individual is going to be turning up for the shift that they've agreed to do or not. But if there is an underlying health issue, so for example, somebody has a bad back and they've had a bad back for a long time, then actually they're probably going to be covered under the Equality Act for a disability, and that would then mean that you've got to kind of think about differently how you deal with that situation. There's going to be more obligations placed on you. So I think it's really important that you think that you perhaps look through an individual's sickness absence to think, well, actually, do they seem to have some kind of underlying health issue here, or is it a case of we've just got this persistent short-term absence where certain individuals not in because they've hurt the toe, they've hurt the elbow, they've hurt the ear, etc. Because that's very different in how you deal with them. And we're going to be focusing on managing long-term sickness here. But there are certainly two elements to dealing with sickness absence. And of course, think about notice pay. If it gets to the stage where you are going to be dismissing an individual, I'm going to talk about notice pay shortly, but just think about how much is it going to cost as well. Please. I think an individual could, a business can think, well, you know, I don't want to kind of be talking to these individuals because they're going to think I'm prying into their health conditions. There's 4 clicks on this one, Karen, as well. So you've got to think about, you know, employers do have a duty to provide work, and they have a duty to get an individual back into work as well. So it's really important that you do ask these questions, and that's why the welfare meetings are really, really important. Because if you don't have this regular contact, an individual can feel like they're forgotten, like they're not part of the business. It's important you tell people about changes, invite them to the Christmas party. They may not be able to come, but certainly let them know about that. And it's important they feel connected to the team, because if individuals feel connected to the team, they're more likely to come back. That psychological barrier is going to be removed. You're more likely to be able to get them back into the workplace, which is the aim for everybody involved. Next slide, please. So looking at the legal part of it effectively. So under the Equality Act, there is a legal definition of disability. And this definition is that a disability under the Equality Act is a long-term impairment which has a substantial and detrimental impact on their ability to carry out day-to-day life. So if we break that down, long-term is generally 12 months or likely to last 12 months. So if an individual is off, for example, 6 months, but medical evidence suggests that they're not going to recover for a good long time, the chances are they would be covered by the Equality Act. An impairment can be mental, physical, diagnosed or not, and having this substantial impact, detrimental impact on their day-to-day life. So the menopause, for example, would fall within this definition. If an individual is really suffering with the menopause and it's really impacting on their ability to carry out day-to-day life. So, you know, for example, having hot flushes or having to constantly go to the toilet, etc., that would have a real impact on your day-to-day life. So the chances are it may be covered by the Equality Act. And things like bunions have been found to be covered within the definition of disability because it's physical impairment, it's lasted long term, and it does have an impact on an individual's ability to carry out their day-to-day activities, go shopping, etc. So just be aware that something that you know, an individual may be complaining of, maybe having on the sick notes, there's a medical condition that you think, well, you know, I'm sure that's going to be fine. We're not going to be covered by the Equality Act. If it does meet this definition, it would be. And then you've got obligations as an employer to make sure that you don't treat them unfavourably, that you make reasonable adjustments, etc., to be aware of that. There are some conditions which are automatically classed as disabilities. So cancer, HIV, etc., they would automatically fall within the definition of disability. And I think it's really important that medical evidence is sought if you're dealing with any kind of medical condition, which is kind of getting towards long term, to understand kind of what are we dealing with here. Does this have a substantial impact on the ability to carry out day-to-day activities? Is it going to be long term? It's really important that you're appraised of the position so you know how to manage it correctly. Next slide, please. So thinking about the formal process, I think there's a few clicks on this one as well, thank you. So you've got to think about what's the likely duration of the employee's absence and can they actually perform their duties. So if you go think about an individual's absence, it is kind of getting towards long term. So they've been off for 3 or 4 months, the fit notes keep coming on, we're having welfare meetings with them and they can't give us any idea of when they're going to be coming back. It's about time that you start the formal process, because if you kind of leave it until, you know, 12, 18 months, you may have missed the boat in trying to get them back into work. So I think if it's a case of you think, well, this is kind of getting quite long term now, then we need to think about the formal process. So it's important you plan the process. So who's going to do what? You exhaust all possibilities. So you think about, well, you know, are there adjustments that we can make? And we evidence that we've thought about it at least. And have we thought about suitable alternative vacancies? And it's really important you think about getting medical evidence. Now, it can be costly medical evidence, and I completely appreciate that. Times are hard, and the last thing you want to be doing is spending money on getting the medical evidence. But actually, in the long term, it's going to really, really help you, because it's going to demonstrate that you've understood what you need to do, you've understood what the medical condition is, and you've understood if there's if you are able to get them back into work or not. Next slide. And you know, the medical capability process has certain stages. I think there's 4 clicks on this. So there's obviously the welfare meetings that we've talked about. I think there's 4 clicks on this, Karen, sorry. So the medical, they've got the welfare meetings, which we talked about. It's really important that you get an expert report as well. So you've got somebody, you've got the medical evidence to show exactly what the situation is, if the individual's going to return to work or not. Then it's important that you have a meeting to discuss the report. And if the report is saying, I cannot see this individual returning to work in the foreseeable future, you would then have the ill health hearing, which would then lead to a capability dismissal. So next slide, please. 4 clicks on this, thank you. So the welfare meetings that we've discussed, it's really important that you have these as part of the capability process. So if we're kind of looking at establishing a reason for dismissal, a fair reason, which is the long-term sickness absence of an individual who can't perform their role, we have the welfare meeting where we kind of say, look, you know, what are your current conditions? When are you going to be able to come back into work? Are there any imminent medical procedures that we need to be aware of? And what adjustments could enable a return to work? So these are the key questions that you need to be asking. If an individual's saying, you know, my length of absence, I cannot tell you when I'm going to be returning to work, then that's when you think, well, I need to start the formal process here, because we can't just have this kind of going on indefinitely. What I would say is, if an individual is saying, well, I've got a really bad back, but actually I'm having an operation in a couple of weeks' time, and my specialist consultant is really, really confident that I'm going to recover fully and the recovery time is not going to be too long, and we wouldn't be advising to start the process now, because it wouldn't make sense, because actually after the operation it may be successful, and hopefully it is, and the individual can then return to work because they've had the operation to deal with the issue why they're off on long-term sickness absence. So we'd certainly wait for that. But it's really important you ask that question so you understand it, because if an individual is saying, well, I am going to have an operation, but actually the waiting list is huge and I think it's going to be about 18 months until I'm going to get the operation, well, you wouldn't be expected to wait for them to have the operation if it's going to be 18 months, because that seems like a very, very long time for you to be using agency staff to cover their absence. So yeah, it's really important you ask those questions to understand, you know, where are we up to? Please inform me of any planned operations or any planned procedures. And again, the adjustments point is really important, because actually you will have a duty if an individual is covered by the Equality Act to make reasonable adjustments. So if it's a case of an individual does have a bad back, but their job is, as providing personal care to service users, and it involves using a hoist, if they've got a bad back, it's going to be difficult to think what adjustments you could make to that role to accommodate that. But it's important that you sit down with the individual and ask them that question. And like I said, it's really important that you have this two-way conversation. And this is the case of Daubney, where it was an employment appeal tribunal, and they said that unless there are wholly exceptional circumstances, an employee should be consulted and steps should be taken by the employer to discover the true medical position. And one thing is certain, and that if an employee is not consulted, I can't see the bottom of it, sorry. Effectively, if an individual is not consulted, then you're going to have real difficulty in getting a fair dismissal process. So it's really important that there's that two-way conversation.
The bottom part, just
Sorry,
for
go on, you can read it, Leon.
I can. It says only one thing is certain, and that is that if an employee is not consulted and given an opportunity to state their case, an injustice may well be done.
Thank you. Yes. I'm sorry, my screen's quite small at the moment. So yeah, exactly. It's really important that we have that consultation process and there's that two-way conversation, so the individual can explain what adjustments could be made, etc. Next slide, please. There's 3 clicks on this. So it's really important that like I said, you start the process when they've been off for an extended period of time and that we can't see when they're going to be returning to work. And it's really important that if that's the case, then we start the formal process. Next click. So why are we doing it? Why are we starting the process? Because we can't continue in a situation where an individual isn't in the workplace because it's going to cost you money to cover their work, and we need to understand how we can plan in the future. And how are we going to do that? We're going to instruct a medical expert, and in that instruction letter we're going to explain to them exactly what their work environment is. What are they expected to do as part of their job? And why are we asking for this report? Because actually we're saying, well, they can't tell us when they're going to be coming back. We can't carry on like this indefinitely. So we need to know if an individual is going to be returning to work, or if we need to look at going down the capability route. Next slide, please. So would you use a GP report or would you go down the occupational health report route? There's pros and cons for each. A GP report tends to be a little bit cheaper, but it can take a while to come back. As we all know, GPs are so stretched. Trying to get a report sometimes can be quite tricky. You have to do quite a lot of chasing. The GP will obviously know the individual, which sometimes perhaps would impact upon the report. But on the positive side, an individual may be more likely to agree to a GP report because they know the GP knows them. So it's kind of weighing it up. Occupational health, I think that would probably be my preference, just because even though they're more expensive, they can probably do it slightly quicker. And also it means as well that they kind of have an idea of a workplace and what adjustments can be made. And can make suggestions, more proactive suggestions, I suppose, about how it works in that certain workplace, because there are certainly specialists in place that know, for example, about working in care homes, etc. So occupational health sometimes can be quite useful because they can give suggestions that perhaps you may not have thought of, or they can very well say, well, I know about this work environment and I don't think this individual is going to be able to work in that work environment, and I can't see them being able to return in the foreseeable future, which will then lead you down the capability process. And it's a couple of clicks on this. So what if an individual is saying, well, I don't want to go and have a medical report? Then as an employer, all you can do is make a decision on the medical evidence that you have available. However, what you need to make sure is that you have in writing somewhere some information which says to the individual, well, okay, you're telling me you don't want to agree to medical evidence. That means that I'm going to have to make a decision on the evidence that I've got. And if I have to make a decision about your future employment, this may very well end in your dismissal. So it's really important that that's somewhere you've got that paper trail to say, well, actually, you've said no, this is the consequence. And then if they still refuse, then you can only make a decision on what you know. And if it's a case of they've been off for 6 months, they can't tell you when they're going to return, you're a small business, you simply cannot afford to continue getting agency covering, etc., then, you know, what else can you do? But it's really important that you set out clearly what the consequences are of an individual saying, I'm not giving you my consent to get a medical report. Next slide. So there is obviously specialist advice that can be sought. So if an individual does have quite a complex health need, then, you know, like, so for example, if they've got this bad back, but they're then under the care of a specialist who's then going to perform this operation on their spine or slip disc or whatever it may be, then I think it would be sensible to obtain some assistance from them with regards to, look, are they going to be able to return to work or not? There is certainly no obligation on you to get a specialist report from a specialist. But if this ever went to a tribunal and an individual says, well, I was dismissed prematurely, you know, I was going to be coming back doing cartwheels in 6 weeks' time, and a tribunal says, well, you know, well, to the employer, did you ask the specialist about if they were going to be able to do cartwheels in 6 weeks' time? And we haven't got anything to say, well, no, that was never going to be the case. And we are in a bit of a tricky situation. So certainly no obligation on you to get specialist advice. But if an individual is under the care of a specialist, it would be sensible. But I appreciate, of course, that costs more time, more money, etc. But it's important just to think about that. If there is quite a specialist health need in place, it may be worthwhile going straight to the specialist to say, look, what are we dealing with here? Please, can you help us, because we want to try and get them back into work, make adjustments, or it may be that the individual, this is the kind of work that's going to be suitable for the individual going forward. Next slide, please. So I think there's 2 clicks on this. So if we get the report in and they say, actually, yes, you know, this individual is going to get better, I'm really confident. And the occupational health advisor says, well, you know, I think that they're going to be okay in a couple of months. I can see them back in the workplace and they're going to be, you know, they're going to be good, they're going to be able to maintain their attendance at work, then the individual would come back into work. If it says, I cannot see this individual returning to work in the foreseeable future, then we would go down capability ill health process. That's kind of when the report comes in, that's kind of when we decide which way we're going to go, because we've got the medical evidence in place to advise us as to what's appropriate and if an individual is going to be able to return to work or not. Next slide, please. So, talked about the Equality Act and the definition of disability. And if an individual does meet that definition, then you know, they shouldn't be treated unfavourably. There's also an obligation placed upon an employer to make reasonable adjustments. And what the legislation says is that the duty arises where a disabled person is placed at a substantial disadvantage by an employer's provision, criterion or practice, so like your policies. If they're placed at a substantial disadvantage because of the employer's physical features, so for example, they can't get a wheelchair through the door, or an employer's failure to provide auxiliary aids. So for example, someone who may be dyslexic, you're not provided them with an aid for them to use a computer correctly, things like that. Now, the provision, criterion or practice, so if they look at your policies, that's been interpreted quite widely. And just an example of it, there's a case of United First Partners Research Against Careers, where an employment tribunal found that an employer's provision, criterion of practice, which was an expectation that an individual would work long hours, so not a requirement, just an expectation that an individual would work long hours. It was found that that was a PCP that placed disabled people at a substantial disadvantage. So like I said, it's a really, they will interpret it quite widely. So there is this duty on employers to make reasonable adjustments. Now, it is reasonable, so an employment tribunal will look at the financial cost of it. So if you're a small care home and you know an individual needs the whole building to be rebuilt, then that wouldn't seem sensible. And you know, think about the practicality of the step. But it is just thinking about what's reasonable for you as a business. There is access to work that employers can use. So for example, like I use the example of a dyslexic employee, access to work can be really, really useful in providing aids for an individual to be able to use a computer, you know, different coloured notepads, etc., etc. So, and you can certainly get support with that. But it is something to bear in mind that if you think an individual is covered by the Equality Act, think about, I've got this duty to make reasonable adjustments. But it is about being reasonable and how big your business is and what your financial resources are as well. Next slide, please. So just thinking about suitable alternative employment specifically, and when we're looking at reasonable adjustments, it's thinking about, you know, what can I do to get that individual back to work? If there is alternative work, even if it's at lower pay or lower status, it's worthwhile offering that to an individual. Because sometimes you might think, oh, well, they would never go that, they would never want that. individuals, a lot of individuals, work is their life. They want to get back to work, and they will accept a different role to be able to do that. I put there the case of Garrick's Caterers Limited against Roland, just to kind of explain, kind of, I suppose, where employers can kind of fall down, I suppose, in this situation. So the employee was a maintenance fitter on shift work, had a heart problem, was off for a year. Now he was certified fit for work, but the doctor said he couldn't do shift work, he had to work during the day. So the company did accommodate that, gave him day work, then eventually said, look, you're going to have to go back onto shift work, it's just not working. He said, I can't do shift work, and then was dismissed. Mr. Garrett went to the tribunal, and he was successful for his claims of discrimination and unfair dismissal. And what the employment tribunal said was that actually the company had not given sufficient consideration to finding him a day job. The company said, well, no, the day jobs all involve lifting, and he can't lift because of his heart problem. But the tribunal kind of did this forensic analysis of his role and basically said, well, no, actually lifting was a really minimal part of his role, and somebody else could have easily done that. It was so minuscule. So actually, you didn't turn your minds to that. You didn't think about how could we get this individual into work and remain in work by putting this adjustments in place. And they found that actually that he had been unfairly dismissed, and it went to the Employment Appeal Tribunal, and they agreed. They agreed with the tribunal as well. So, like I said, it's thinking about outside the box. It's thinking about adjustments. If an individual is asking for adjustment, it's kind of showing that you've thought about it. Showing if you can't accommodate, why can't you accommodate? The next slide, please. I think, as well, I just wanted to mention as well about suitable alternative work, thinking about flexible working as well. The government are really keen on flexible working at the moment. So I just wanted to highlight to you that there is a new private members bill which is going through the House of Lords at the moment with regard to flexible working. It's the Employment Relations Flexible Working Bill. Normally private members bills don't kind of see the light of day. There's been quite a few that are going through the House of Lords at the moment. Quite a few have received royal assent. And that's because the government hasn't had time to put together an employment bill of their own. They have been backing instead private members bills, and this private members bill, it's right at the end of the process now. And what this is going to do, it's going to give individuals the right to request flexible working from day one. Currently, they need 26 weeks employment to put a flexible working request in. It's going to be a day one right. Individuals are going to be able to request 2 lots of flexible working in a 12-month period. Currently, it's only 1. And employers currently have 3 months to deal with a flexible working request. That's going to be reduced to 2 months. But just to flag, there are quite a lot of private members bills that are receiving royal assent at the moment. It's worthwhile looking into those. But flexible working, something that the government are really keen on, and things like with the menopause, etc. If an individual is struggling to sleep, maybe look at flexible working. Can they start later? If that's the case, if they're struggling to get out of bed in the morning, maybe not fully functioning at 7 o'clock in the morning, but they might be by 9 o'clock. Think about flexible working, because the government are really, really keen on that. And of course, there is this new bill that's going to be coming law pretty soon. The decisions to dismiss, like I said, it's a management question, not a medical one. So we get some clients who get the medical report in from a GP or an occupational health, who kind of say, I don't think this person's going to be able to return to work. And then, think, well, okay, that's kind of given us the green light just to simply dismiss. It has to be a management decision, because it's going to be you who goes to tribunal. So you can't just say, well, the GP said that, so there was, that's what we're going to do, because you've got to show actually, you've got to make that decision based upon everything in the round. So can you make adjustments? Are there any suitable alternative vacancies? But of course, if the medical report saying, I can't see this person coming back to work, I can't think of any adjustments that you could make, then that's going to make it a lot easier when you go through the process. If there is a conflict of medical evidence, tribunal will often be satisfied if you've relied upon occupational health, because they understand about the business, whereas perhaps GPs might not. So if there's that conflict, occupational health, tribunals tend to kind of rely upon that a bit more. But what I would highlight, and what is absolute key, is that medical evidence needs to be up to date. What you can't do is get a medical report and then 6 months down the line think, right, I've finally got some time to deal with this HR issue. I'm going to rely upon that, because a lot happens in 6, even 3, 4 months. So it's really important you get up-to-date medical evidence. If not, you would certainly be criticised at the tribunal, and any dismissal would potentially be unsafe. Next slide, please. So considerations for a fair dismissal, you know, like I said, this is kind of summing up, I suppose, that, you know, make sure the timing's right, make sure there isn't any kind of imminent medical procedures which may impact on the individual's ability to return to work. Have you thought about all the alternatives? Have you thought about making reasonable adjustments? Can you document all of that? And generally speaking, the longer the absence, the more reasonable it's going to be to look at a potential termination capability, because actually you can't carry on like that indefinitely. Next slide, please. Conscious of time, so just wrap up. So like I said, with the termination procedure, it's important that you have a meeting with the individual, you've had the medical report, you've had a meeting with them to explain about, you know, are they able to come back to work or not? The individual saying, well, I can't see me coming back to work. Have the termination procedure. So effectively, you would think about making adjustments for the hearing. So, you know, would it be better to have it at a location close to their home? Family members, sometimes it's a good idea to have them there as support for the individual, think about reasonable adjustments for them. They should be given the right to be accompanied in any event by a trade union rep or a colleague, and there should be a note taker there, and make sure the person who's holding the meeting has the authority to make the decision that needs to be made at the end of the meeting. Make sure you go over the whole process, make sure you've not missed everything, and then don't make the decision in the meeting, make sure you go away, think about it, and then any subsequent dismissal would be on the grounds of capability. Next slide. Just touching upon what they would then an individual would receive if they then are dismissed for their long-term absence. They would have continued to accrue holiday pay whilst they're absent, so factor that into any payments that are due. Normally it's use it or lose it, so if you're not used your holiday by the end of the holiday year, then you lose it. If someone's off on sickness absence, then that continues to accrue onto the next holiday year. Now they can carry forward, it's up to 20 days, so 4-week holiday, because it is based on European law. So it's the 4 weeks European law. In the UK, we give an extra 1.6 weeks, but the case law about carrying over sickness absence is from Europe, so that's the 4 weeks. And then that 4 week holiday would expire 18 months after the end of the holiday year in which it's accrued. So there's the explanation of it there. Again, just by way of legal update, the government has announced a consultation on actually amalgamating all the holiday pay into one job lot. So in the UK, we get 5.6 weeks, 4 weeks comes from Europe, 1.6 weeks comes from the UK. The government are kind of saying, well, I think we're going to amalgamate it all, and then we're going to have one rule for all holiday, which will be so much better for employers because it will be less of a headache than having to work out which bits of Europe, which bits aren't. So just be aware of that consultation as well. That is ongoing. And notice pay, there are quirks with notice pay. I've set it out there. It's in the Employment Rights Act. It depends on what the employer's notice is as to what an individual is paid for their notice pay, whether they get SSP or whether they get full pay or whether they get no pay. I've set it out there. It is quite complicated calculation. So if you do want to have a query about holiday pay, notice pay, then you would, your citation client, you can call citation, or certainly you can use that to kind of determine what would be paid. Next slide. I think there's a few clips here. So just being aware that there is a claim under Section 15 of the Equality Act for discrimination arising from disability. So obviously you aren't dismissing somebody because of their disability, you're dismissing them because they can't do the work that you've asked them to do because of their ill health. But actually, potentially you could say, well, an employee could say, well, actually, I think I've been dismissed because I've been discriminated against because of something arising because of my disability. And the good news to employers is that actually these kind of claims can be defended if you can show that actually what you've done is a proportionate means of achieving a legitimate aim. And your legitimate aim in the situation would be to run an efficient care home, for it to be sufficiently staffed. And that's fine. It's just important that if you are going to go down this process, that you document absolutely everything as to why you need to do what you need to do. And then you'll be able to defend this claim. So I'm bang on 5 past. I'll just pass over to Leon just to wrap up. Sorry, and this is just an overview of the process.
Lovely. Thank you for that, Kat. So yeah, I'm glad I'm not an employer because I now live in terror of long-term sick and I don't want to deal with it. So no, very illuminating. I haven't had any questions in the chat box, but there's still plenty of time. Do feel free to add them, add your contact details, or indeed, as with the prior session, do forward them on to Karen. I'm sure she'd be happy to send them across to us, and we'd be delighted to answer them for you.
Will do. Okay, thank you very much, Leon. That's lovely. And thank you very much, Catherine, for your fantastic delivery. There's so much to take on board.
I know.
And yeah, there is so much new stuff coming around as well. So it's really useful for everybody to hear. If anybody would like to send me an email and would like to connect with Catherine, if they've got any problems, I'm sure Catherine will help you. So really do, as Leona said, there's one question in the chat, I think. Let me just have a quick. Very informative. So it's always useful to sort of have an update, because we think we know how to manage, but it's sort of having that reminder, and it's having that sort of knowledge of what's coming down the track, basically, isn't it? So yeah, thank you very, very much. As Catherine has said, we're a little bit over time, so if there's no more questions, or if you want to put questions in the chat, then I can share them with Catherine afterwards. So if I'm going to stop sharing, and I'm now going to hand over to our last but not least guest, Alicia. Alicia, the floor is yours. Thank you.
Lovely, thank you. Right, let me just do my screen sharing. Bear with me. Hopefully.
You can see that.
That's going to come up for everybody.
Yeah.
Brilliant. Lovely. Well, thank you ever so much. So I'm Alicia Misons. I'm the Health and Wellbeing Lead for Social Care, and I'm covering Bristol, South Gloucestershire and North Somerset. So I just want to speak to you today around looking after yourself and being able to then to look after your colleagues as well. I think it's really important that we find ways that we can look after ourselves and be aware of our well-being. And once we've achieved that, we're then in a much better position to then support our colleagues around us. And then just having that knowledge about when to look for help, either for ourselves or what help is there to signpost our colleagues to if it's needed. So if we think about well-being, well-being is when we're in our most positive place. It's being at our best, whether that's at work or at home, and it's a very personal thing. So well-being will mean something to one person and something very different to another. So it's about finding what's right for ourselves and when we're in our good place of well-being. And this can be physically, emotionally, and psychologically. And obviously, as we're working in this caring profession, actually sometimes we see it as the cost of caring, they call it, because we are prone to caring for other people and making sure that their needs are met first. And that often comes at the detriment to ourselves. So we need to remember that it's really important that we nourish ourselves and make ourselves the best possible that we can be, so that we're in a much better position to then deliver the care to the people that we support. So looking after ourselves. So I think we're all aware of the research and science around physical exercise and physical activity, and what that does about the endorphins it releases, and it makes a real positive impact on not just our physical health, but on our mental health as well. So hopefully all of you here today are aware that we have funded access to Key Active for anybody working in social care in Bristol, North Somerset and South Gloucestershire. So Key Active are providing a device, and it's all around making small changes to our daily activity levels, so just movement, for long-term health benefits. So if you're somebody that thinks I need to get more physically active, and it's not about just hitting the gym 5 days a week, it's just about these physical movements and being conscious about what we're doing every day. And making sure that we are being less sedentary and more active. So Key Active are able to support with this. So it's a device that will be sent to you. So it looks like this, and it comes with 6 telephone mentoring sessions. So they'll talk you through about those movements, about how to use the device and support you with your goals. And then after those, the 12 weeks of support, you get to keep the device and access online, so you can continue something, because the whole point of it is about long-term health benefits for the future. So if you haven't had those resources, or you're not aware, then please do send me an email or put something in the chat to Karen, and she can forward those on, so I can make sure that you've got resources, because something you can phone up with for free or sign up for on the website. So again, looking after ourselves, and it is about things that we think are common sense things, but it's just reminding ourselves, we do this all the time for our residents and the people that we support, making sure that we are eating well. And it is about having that healthy, balanced diet, because it is easy to get those pre-processed foods, binge, grab the cupboard, that packet of biscuits, the packet of crisps, because you're in a rush, you haven't got time. So it is just making sure that we make time to eat healthily. And obviously with the weather we've been having, hydration is really key. And we're really conscious of our clients and the people that we support. We're having hydration stations and making sure that they're staying hydrated. But it's having that time for ourselves to actually think, oh God, I haven't drunk for the last 3 hours. I need to have a drink. Just making sure that we build into our daily routines time, and make sure our colleagues, again, Remind your colleague you had a break, make sure you take your break to get a drink. So apart from Key Active, there are other devices that you can use, other resources that are free apps that are there. On the screen, there's one that is linked for Nursing You, and it was designed for nurses, by nurses, and it's around sort of health and well-being. Again, so there is lots of different apps that people can use. So by being aware around sort of stress, obviously, care sector, we know the daily pressures and stress that we are under. So by being aware of what causes our stress and anxieties and putting actions into place to relieve those pressures, we can develop stronger resilience and improve our ability to respond to those challenges as they present themselves. So the causes of stress, like I said, it will vary. Sometimes it can be home, sometimes it can be work, or a combination of all of it. There's not one single source of stress. It'll be a combination of different things. But what we need to do is sort of proactively manage that stress and find mechanisms that work for us as individuals to help relieve those stress pressures. So as you can see on the screen, there's the image of the stress bucket. And it is about thinking about all these daily things going in drip by drip. It just builds up and up. So we need to come to a point where we can help relieve those pressures. And I mean, it is useful to have stress, get that adrenaline going, in small bouts. It makes us sure we hit that deadline, that we get that target done, that we achieve something that we need to do that day. But when it does build up, then it become that issue where the bucket can overflow. So it's really important to be proactive and find ways that help us relieve and address those stress on a day-to-day basis to stop that bucket getting to that point. So for some of us, like I said, it could be a physical activity that we've mentioned, making sure that we are eating well, looking after our bodies physically. And again, as mentioned before, getting enough sleep. It's really important that we look after our bodies and get sleep. And it's finding techniques that work for ourselves. So one thing that we can all do is breathing. And there's some really good, like I said, some really simple breathing exercises that just helps. When you feel like things are getting on top, you can just stop for a minute, take that breath. And there is the box breathing exercise where you breathe in for 4, hold for 4, breathe out for 4, and pause for 4. And just doing that for a few moments and building those into your routines, or when you know you're about to sort of go into a meeting, or you've got to have a conversation with somebody that's going to be difficult, just prepare yourself for that. And things about decompressing as well during the day. People use sort of grounding methods. So, if you're able to kick your shoes off and literally just feel the ground beneath your feet, just sort of move your muscles through, bring yourself back to yourself, focus on yourself for a moment, just take that time, 5 minutes to step away from the desk, to get up and have that drink, to have those deep breaths for yourself. There is obviously things like the meditation techniques, and like I said, lots of exercises online around self-help, different audios and self-help therapies. So it's just being aware of what's out there and finding things that works for yourself. For me, I love things that smells for me, scents for me are really important. So things that I can just put some spray on my pillow or my wrist, some nice hand cream when you get home that smells nice. Just for me, that's something that helps release me and calms my mind. So yeah, so looking after ourselves. So it is about in our routines, just finding that 10 minutes in the day where we can actually check in on ourselves and think, have that moment to breathe, to calm down. And it could be, for me, I find lists really helpful. So if you've got your heads full of things flying around, it's just about journaling or just providing that list of things that you need to focus on tomorrow. And when you get to work, then it's be able to tick off those lists and you feel you're achieving something for yourself. And yes, that those lists, more things will add to it. But you've got them listed, you recognize them, and you'll deal with them in a certain way. So it's just finding ways and coping mechanisms for yourself and finding the time in the day, whether it is to go and have a walk, have a relaxing bath at night, just to check in on yourself and how you're doing. So if you think about the 5 ways of well-being, so about connecting, like we said, just making sure that we are touching base with our friends, with our family, having that time for ourselves, being active, again, we've addressed, and taking notice. So obviously, if you are able to go for a walk, sort of appreciate the environment around you, take notice of nature around you. It's really important, again, sort of keep learning, keeping our minds maybe focused on other things, apart from our stress and worries. So it could be, finding something new or just getting into reading, just taking that focus and learning something different, and giving. Obviously, as part of our role of caring, we are giving, and like I said, that's part of our 5 ways of well-being as well, because it is a rewarding role that we're doing. So once we feel more adapted about looking after ourselves, and we've got our little toolkit of how we can, find out ways of dealing with our stress levels and being more resilient to things, we're in a much better place to then be able to help our colleagues. And we all know that having that culture at work, a supportive culture, is a brilliant place to be. It really helps with staff morale, staff well-being, and it will help with staff retention and recruitment as well. Because if you've got a really supportive culture at work, it's just a really nice environment to work in. So it's about thinking about what we can do to help contribute to that kind of culture. And it is about having that time to listen to colleagues and actively listening, just giving that space if people want to talk to you and you can just listen to them. And we can build those into sort of regular team meetings, thinking about positively about staff morale, and look out for signs if you do see somebody that's struggling. Perhaps, like I said, we obviously addressed earlier today that perhaps they have been off sick, and it's about making that connection with them so that they feel more comfortable to be returning to the workplace, just making that more comfortable position for them to feel welcome back into the workplace. And it's really nice when somebody gives you that compliment and you think, oh, that's really nice to be appreciated. And it's remembering that actually, yeah, let's share that more. So when you see somebody going above and beyond, or they've done something really nice, just say thank you. And then remember yourself to thank yourself as well and think, actually, yeah, I've done a good job today. I've done well. So just giving yourself that bit of self-praise as well. So yeah, so thinking about this supporting colleagues at work. Things don't, it is a very stressful environment, but it's focusing on what we can do well. So when we've gone through a difficult period, it's looking at the learning. So there's no blame, there's no blaming, it's looking at how can we move forward for things. So, okay, this hasn't gone well recently, but what can we do together to actually focus on going forward? And it's really important to engage other staff and colleagues in that as well, get people's opinions, start sharing it around so people feel empowered to move forward as a team. And again, around sort of supporting cultures at work, there is more we can do, like I said, with champions, about being that person that helps promote health and well-being, and about role modeling kindness. I think we can all do that. So it is about compassion and caring for your colleagues, being understanding and honest. Yeah, it's a difficult role we're doing. We don't all have the answers, but we're on the same journey and we can do this together. And then suddenly that just makes everybody feel like they're in a safer environment. They feel comforted, that they're knowing that they've got their colleagues around them. And again, like I said earlier, encouraging your colleagues to take regular breaks, that they are find them ways that they can look after themselves, making sure that they're building their little toolkit of what helps them, and check in on them. How are you and how are you really? Give them that time to talk to you. There is training if people wanted to do Zero Suicide Alliance. They have a 20-minute free e-learning course that anybody can access. So if people want to learn more, you can go on the website and access that. And then just thinking about the culture setting again, about sort of, we could build in regular conversations about around well-being. And perhaps if you're managers and team leaders, you can think about when you have your supervisions about how you could maybe build those conversations in, and finding those listening skills. So on the NHS England website, there is lots of videos around demonstrating well-being conversations and how to be an active listener. So those resources are freely available for anybody to log in, just little short 5-minute videos to watch. And it just helps people feel more confident to be able to support colleagues and to be able to listen actively. And if you're a manager or team leader, maybe building in those wellbeing conversations as part of your supervision sessions, to making sure you're checking in with your colleagues regularly. And perhaps if somebody is struggling, you can use wellbeing action plans. So it's about going through whatever it is. It might not be work-related, it might be something different, but it's just something for them, like what is that they're struggling with and what can they then do to help support themselves. So again, getting people to be thinking about their own toolkit of what they can do for themselves, and being aware of what support's available for them. I think it's important to recognise actually when things change and when actually people do need professional help, whether that's for yourself or for a colleague, but it's where they're experiencing high levels of distress and they're not able to focus on daily routine activities at work or at home. Perhaps they're using more alcohol or other substances. And people are worried about them and concerned for their safety, then obviously those are the times when you need to know that people do need to seek professional support. So some organisations may have an employee assistance programme in place. So it's finding out what your organisation offers, what access that can be. Sometimes it can just be a stress helpline, and other times it can be 6 counselling sessions, either one-to-one by face or online. And sometimes they're open to family members as well. So it's just being aware of what your organisation can offer. Or perhaps it is internal resources. You may have somebody that has got counselling experience or first aid mental health persons in the organisation. So it's knowing internally what's available. Obviously being aware of what's available. There's lots of resources and guidance and charity supports online. And then also you've got the professional supports in terms of the local and national offers of organisations. So on the screen, I've just put a few resources just for everybody to be aware of, that there is lots of health and wellbeing stuff out there. And I've just pulled some of the key ones which are freely available and accessible to everybody. And on the next slide again, lots of self-help, different things on the NHS that's available. Mind has got some really good resources. So it's just being about, what's there to help support people so that we can have a better understanding to help ourselves and then be in a better place to help our colleagues. So if we're working in Bristol, North Somerset or South Gloucestershire, you can self-refer to Vita Health Group. The email and the phone number are on there. So anybody working in social care can get support through them for any stress, anxiety, depression. In Bristol, we've also got Nelari, which is a BAME group. So if you need any more culturally specific support, they're a charity that people can access. And you've got Relate, which is obviously a relationship support team. So again, the details are on there. And then you've got the national offers in terms of like Samaritans, obviously your GP, NHS, there's also Shout and SOS Silence of Suicide as well. So just some of the national resource lines that are available. So as some of you may be aware, I started a project for health and wellbeing champions in social care. So this was launched in March and I had 55 grants to help support with getting more champions in social care workplaces. And the role of the champion is about just communicating. So great if they want to go on and do further training to be a mental health first aider or get any sort of further qualifications in terms of counselling and support like that. But for the role of champion, it is about just being that communicator. So it could be just 10 minutes a month just to make sure that we're sharing resources with our colleagues, we're a point of contact so that we can signpost for other help if people know about it, and that we are aware of what our internal offer is from our organisation. So if you have got an employee assistance programme that people can access. And so with the 55 organisations I've been doing, we've done surveys talking to our staff and finding out how they currently are, and we engage with them around what we wanted the grant money to be used for to help support their health and wellbeing in that workplace. There's also some toolkits that we put together, which is for managers, a guide around health and wellbeing, the Health and Wellbeing Champions Guide, and a workforce care plan for all the staff. So those grants currently have all been taken, but I'm extending the offer to join the Champion Network. So if it's something that you'd like to be part of, so we've got those toolkits which are available. I'll also be adapting our survey. So again, you can just touch base and see how everyone's doing and engage with the staff around wellbeing and perhaps think about what else could be done to support your wellbeing in the workplace. We also provide resources for different themes every month. So in advance of the next month, I'm providing some resources that could be shared with their colleagues on the themes that are coming up. And it's all about keeping health and wellbeing fresh on the agenda. And it's, like I said, sharing and making things normal, like the menopause. Like I said, that's in the health and wellbeing care in our care plan. It is about normalising it and making that culture feeling that change about being a really sort of positive environment to work in, which is supportive. So if you'd like to sort of be part of that network, we also have monthly share and learn sessions, which have just started. So our second one's coming up next week. There is a QR code on the screen, and I'll also put the little link in the chat. So like I said, if you wanted to still be part of that, then please do get in touch with me, and that'd be great to have more champions on board. So thank you ever so much. I think that's pretty much the end of my slides. So thank you so much for listening.
No, thank you, Alicia. That was, we've heard some really great stuff today, haven't we? All of the presentations have been related to health, how you deal with health, how you manage long-term sick, and I hope you have all found it really, really useful. I know I've taken away such a lot. I'm amazed how much free support there is out there that Alicia's put up. I didn't realise there was so much, and it's accessible for everybody. It's just bringing it to your attention, isn't it? And I think making everybody aware. So Alicia's just shared in the chat the link. So if you'd like to, or if you have any questions afterwards, if you want to put your email into the chat privately to me, if you've got any questions, I will forward it to any one of our speakers. So Does anybody have any other questions? Has anybody got anything they wish to share? I'm just having a quick look at the chat. No. Okay. Okay, so that leaves me to say thank you to everybody for joining us today, and I hope you've taken away some really useful information. You can be on the lookout for further workshops that Care & Support West are running, help and guidance that we give, all advertised on our newsletters that we send out. And as I said, this recording will be uploaded onto our website. So I'm going to stop sharing now, stop the recording, sorry.